What happens during a LEEP procedure for CIN? Imagine a visit to the doctor where a tiny, precise surgery is performed to catch and remove abnormal cells before they turn into cancer. That's what a loop electrosurgical excision procedure, or LEEP, is all about. It's a common treatment used when a pap smear or colposcopy shows signs of cervical intraepithelial neoplasia, or CIN, which are precancerous changes in the cervical cells. The main goal is to remove these abnormal cells early and prevent cervical cancer from developing. During the procedure, you lie on an exam table with your legs in stirrups, similar to a pelvic exam. The doctor gently inserts a speculum into your vagina to hold it open and give clear access to your cervix. Sometimes, a colposcope, which is a special magnifying instrument, is used to look closely at the cervix. To make abnormal areas easier to see, the doctor might apply a vinegar solution, which causes abnormal cells to turn white, highlighting them clearly. Next, local anesthesia is given to numb the cervix, so you won't feel pain during the procedure. Once numb, the doctor takes a thin wire loop that's heated with an electrical current. This loop is carefully passed over the cervix, cutting away a small, thin layer of tissue that contains the abnormal cells. You might feel some pressure, cramping, or a dull ache, but the procedure is quick, usually lasting about 10 to 20 minutes. Some people may feel faint or dizzy, so it's important to let your healthcare provider know if you do. If the abnormal area is larger or extends into the canal of the cervix, the doctor might use different-sized loops or make more than one pass to ensure all abnormal tissue is removed. The tissue removed is sent to a lab for examination to confirm the presence of abnormal cells and to check that all the affected tissue has been excised completely. After the removal, the doctor applies a medicated paste, often called Monsel's paste, which contains iron to help stop bleeding and promote healing. It's normal to notice some black discharge for a few days afterward. The entire procedure is outpatient, meaning you can go home the same day and no general anesthesia is needed. Following the procedure, mild cramping and some vaginal discharge can last for up to 2 weeks. While LEEP is very safe and effective, there are some risks, including bleeding, infection, or weakening of the cervix. This weakening could potentially affect future pregnancies by increasing the risk of preterm birth, but such outcomes are rare. Overall, LEEP has a high success rate in removing precancerous cells and reducing the chance of developing cervical cancer. In summary, a LEEP is a precise, minimally invasive procedure that uses a heated wire loop to remove abnormal cervical tissue. It allows doctors to treat and diagnose CIN at the same time, helping to protect your health while preserving as much of the cervix as possible. If you're considering this procedure, it's important to discuss all your questions and concerns with your healthcare provider to understand the benefits, potential risks, and what to expect during recovery.